In 1847, a Hungarian doctor working in a Vienna hospital made a discovery that should have saved millions of lives immediately. Instead, it destroyed his career, his reputation, and eventually his mind. His name was Ignaz Semmelweis, and he discovered that doctors were killing their patients by not washing their hands. He proved it with data. He reduced the death rate in his ward from 18% to 1% by introducing a simple hand-washing protocol. The medical establishment refused to accept his findings. They attacked him, dismissed him, and eventually had him committed to a mental asylum. He died there 14 days later, almost certainly killed by the same infection he had spent his career trying to prevent. He was 47 years old, and he was right about everything. In the 1840s, the Vienna General Hospital had 2 maternity wards. The first clinic was run by doctors and medical students. The second clinic was run by midwives. The death rate from childbed fever in the first clinic was catastrophically higher than in the second clinic. In some months, 10 to 18% of women giving birth in the first clinic died. In the second clinic, the rate was consistently below 4%. Women knew about the difference. Pregnant women begged not to be admitted to the first clinic. Some gave birth on the street rather than risk it. The doctors were aware of the disparity but had no explanation for it. Various theories were proposed: overcrowding, atmospheric conditions, even the shame of being examined by male doctors causing a kind of moral fever. Nobody proposed that the doctors themselves might be the cause. Semmelweis began investigating systematically. He noticed that the doctors and medical students in the first clinic often came directly from performing autopsies to the maternity ward without washing their hands or changing their clothes. The midwives in the second clinic did not perform autopsies. In 1847, a close friend and colleague of Semmelweis named Jakob Kolechka died after being accidentally cut with a scalpel during an autopsy. His autopsy showed the same tissue changes as the women dying of childbed fever in the maternity ward. Semmelweis made the connection. Particles from cadavers were being carried on the hands of doctors from the autopsy room to the maternity ward and introduced into the bodies of women giving birth. The doctors were infecting their patients with the remains of the dead. Semmelweis introduced mandatory hand washing with chlorinated lime solution in May 1847. The results were immediate and dramatic. The death rate in the first clinic dropped from 18% to 1.27% within months. Women who had been dying at catastrophic rates were surviving. He had proved his theory worked beyond any reasonable doubt. The leading obstetricians of Europe rejected his findings anyway. Some could not accept that doctors could be the cause of their patients' deaths. The idea was not just scientifically challenging, it was morally offensive to them. Others rejected his findings because Semmelweis could not provide a theoretical explanation that fit within the existing understanding of disease. Germ theory would not be proven until Louis Pasteur's work in the 1860s. Without it, Semmelweis's data was compelling, but his explanation was considered inadequate by men who needed a reason to dismiss it. The most prominent obstetricians of Europe lined up to attack his work. Charles Meigs, a prominent American obstetrician, said that doctors were gentlemen, and gentlemen's hands could not be unclean. Karl Eduard von Siebold, one of the most respected obstetricians in Europe, publicly dismissed his findings. James Young Simpson, the leading British obstetrician, attacked his methodology. These were not fringe voices. They were the most respected figures in their field. And while they debated and dismissed, women continued dying in the first clinic at rates that Semmelweis's simple protocol had already proved could be prevented. Semmelweis responded to his critics with increasing fury and desperation. He wrote open letters accusing prominent obstetricians of being murderers. He became obsessed, erratic, and increasingly difficult to work with. His behavior alarmed his colleagues and his family. In 1865, his colleagues had him committed to a mental asylum in Vienna. The exact circumstances of his committal have never been fully established. Some historians believe he was showing genuine signs of mental illness, possibly early-onset dementia. Others believe he was committed primarily to silence him and remove him from public life. What is documented is that the conditions in the asylum were brutal. He was beaten by guards. He was restrained. He was subjected to treatments that were standard for the era, but would today be recognized as deeply harmful. He died on August 13, 1865, 14 days after being admitted. The official cause of death was septicemia from an infected wound on his hand. The wound was almost certainly caused by beatings from the asylum guards. The man who proved that infection on hands killed patients died of an infected hand wound in an asylum where he had been sent by the colleagues who refused to believe him. Louis Pasteur proved germ theory in the 1860s. Joseph Lister introduced antiseptic surgical techniques in 1867 based on Pasteur's work. Within years of Semmelweis's death, the medical establishment had accepted everything he had been saying. His hand-washing protocol was adopted universally. He was posthumously celebrated as a pioneer of antiseptic medicine. The men who had dismissed him, attacked him, and had him committed were never held accountable for the women who died in the years they refused to accept his findings. The phenomenon of rejecting new evidence because it conflicts with existing beliefs is now called the Semmelweis reflex in his honor. The question his story forces you to ask is not whether institutions are capable of destroying the people who threaten their self-image with inconvenient truths. The question is, how many Semmelweises there are right now, people with correct answers being dismissed and silenced by institutions that cannot afford to admit they have been wrong. And how many people are dying while those institutions protect their pride?